Have you found yourself consumed with worries over your child's breathing issues, or you're often exhausted with anxiety thinking of your child's respiratory illness? Instead of succumbing to fear, let's channel our energy into understanding this condition that impacts our precious ones. By delving into the intricacies of asthma, we equip ourselves with the knowledge to navigate its challenges and support our children effectively. Let's transform our apprehensions into proactive learning, empowering ourselves to recognize asthma signs, manage its symptoms, and champion our child's respiratory health with confidence and resilience. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and to help us understand the complexities of asthma in our little ones, we have with us renowned health expert Dr. Meghana Phadke Sultania. Dr. Meghna is an accomplished pediatrician and neonatologist with more than 12 years of experience. She specializes in child health and development and currently practices at the Capsule Child and Neuro Multi-Speciality Center in Faridabad. Her areas of expertise include managing pediatric patients, immunization, pediatric infections, seizures in children, and nutritional issues for both pediatric and adolescent patients. Dr. Meghna, THIP Media welcomes you, ma'am.
Hello, thank you so much.
Thank you for joining us today, ma'am. And ma'am, as we all know that asthma can be a very critical condition, right? If ignored,
Yes,
particularly in children. So
yes.
I'm going to So, ma'am, I'm going to start off this discussion with the most fundamental question that what is pediatric or childhood asthma and how is it different from that of adults?
Yes. First of all, asthma is a condition we call as hypersensitivity of our airways, right? Large
Right,
airway, a windpipe, and even smaller airway. So,
right,
patient basically feels breathing difficulty, is not able to exhale out properly, and then inhalation and exhalation both get affected in the final run, right? With children, what happens is that first of all, they cannot tell you the problem, right? And second, what is it is that sometimes simple fever can also lead to heavy breathing. So in childhood asthma basically differs from adults on these points that picking up symptoms and signs is difficult.
right.
Secondly, cardinal symptoms, as we call it in adults, might not be present in child. The child can simply be lethargic or not responding, or aphonic, means आवाज ही नहीं आना, right? Even that can be a feature. And third, this is a very highly contributed childhood asthma, not just by genetics but also by environment. In the recent days, because of AQI, air pollution, also certain viral bronchitis or particular tendency of having recurrent wheezing sometimes coincides with asthma, which is not exactly an asthma. Certain babies who are having heart disease or say immune problems or immune deficiencies, they are prone for particular infection which can mimic asthma, or we call it as a hyperreactive airway disease. And children who were prematurely born, like 28 weekers, 30 weekers, who were on ventilators or received a lung expansion therapy at that type of time of particular NICU time, then also they are very much prone to develop what we call as bronchopulmonary dysplasia, which in turn can lead to a lung condition which will mimic something like an asthma. So
Mm.
that's how childhood asthma differs from adults. The good point is that 60 to 70% of the childhood asthma can resolute and
Mm.
might not be there when they progress to their adulthood. So this is basically a brownie point when it is considered about childhood asthma.
Okay. Like ma'am, you just mentioned about the genetic and the environmental triggers that might be the basic reason for childhood asthma. So, a very important question that do children have a higher prevalence of asthma than adults do?
No, we cannot certainly say it in that way. It's
Okay.
just their contributory factors are different. And
Okay.
adulthood asthma is something which is persistent from childhood, or it can be newly acquired from an
Okay.
adult. From
Okay.
example, an adult whose working environment suddenly changes. He starts working in a factory. He has never had any lung issues. And
Right.
because of the factory, maybe heavy element exposure, or maybe which is present in some farm related issues, farm related products, he may acquire an allergic asthma because of that, right? In
Okay.
adults, in geriatric patient, मतलब बहुत बड़े जो age के लोग होते हैं 70-80 साल, something like that, they might have something called as COPD, which is absolutely different than asthma, but
Okay.
it mimics as a breathing difficulty. So that's why the contributory factors and the causes can be extremely different in both. So we cannot really say that this much is more prevalent and that much is not.
तो मैम जैसे आपने अभी बताया कि छोटे बच्चों के साथ में सबसे ज्यादा एक प्रॉब्लम है कि वो अपनी परेशानी बता नहीं पाते, राइट?
Yes.
सो
Yes.
हाँ जी, सो इज देयर अ डेवलपमेंटल स्टेज at which children usually experience the most severe symptoms of asthma? And if so,
Yes. Yes.
हाँ जी, so how do these differ from that of adults? Can parents recognize if their child, falls into this particular group?
Yes, if well educated and if they are told properly by their doctor, then parents can get educated to understand that the child is in trouble. See, between 2 to 5 years of age, when we actually call it or label it as an asthma, that time the child sometimes just has heavy breathing or
Okay.
panting, maybe. Child
Okay.
refuses to feed. Sometimes there can be bluishness, or sometimes suddenly the child goes silent and just you can see the noisy breathing which goes like something like that, and the chest is looking very up and down in a very inappropriate way. These are the signs where the child has a problem.
Okay.
Many times in the same age group, nasal block is most common complaint. So
Okay.
very often gets confused with asthma, but
Okay.
that noise is very different and
Okay.
than the chest noise. So that's how basically in Hindi what we call pasli chalna, या chest up and down बहुत frequently होना with sort of breathing difficulty. That is the cardinal sign. But see,
Okay.
that happens very later. So
Okay.
when the child is refusing to feed and child is having mild heaviness of breathing and noisy breathing, unable to sleep, vomits, right? All of these happens. That is a good time when the parents should actually get the child checked and not
Okay.
wait till it actually manifests to such a severe level when it is audible, right?
Okay.
When it is
Right.
easily recognizable, that means something is grossly wrong and child
Okay.
needs an immediate intervention, and you should not stay up at night. You should actually visit any hospital casualty.
Okay. So right. So early intervention in this particular condition is the key, right?
Yes.
So
Yes.
uh,
That means a small age group, the more it is apparent, that means something is grossly wrong.
right.
That's what I meant. Yes.
Yes, ma'am. So are there any established treatment guidelines for managing pediatric asthma?
Yes, yes, absolutely. It's one of the basic emergencies in pediatrics, any kind of respiratory or breathing difficulty, because it is not just asthma. Sometimes, as I said, it could be just a simple foreign body. एक
Okay.
मटर है या कोई दाना फंसा लिया, that can also come up as a breathing difficulty. So anytime
जी.
you find these red flags which I had just mentioned
जी.
about heavy breathing, noisy breathing, bluishness, है ना, half ना जिसको हम कहते हैं, and child going silent, lethargic, not feeling well, or excessively sleepy, dozing off. These are all signs where you need to take, because it could be any airway obstruction, it could be just simply upper airway problem, it
Right.
could be actually an asthma, or it could be some other acute exacerbation जिसको हम बोलते हैं सडनली कोई चीज का ज्यादा प्रखरता से उसका सिम्टम दिखना, then underlying
Mhm.
disease could be BPD or bronchitis. तो ऐसा
जी.
कुछ भी होता है तो you have to immediately visit, and there are treatment guidelines, because first and foremost sometimes you need is oxygen which is not readily available at home. Many times parents think कि इसको ना nebulize करते हैं तो ये ठीक हो जाता है तो wait करते हैं, But नहीं,
जी,
red flags हैं, so you have to maybe nebulize at home once. If the still it is there, then immediately take the child, because the next available treatment is possible only in hospital. It could be injectable, it could be giving oxygen, right? And that has a particular timing. If that timing is reached, then it really benefits the child.
ओके, राइट मैम। सो मोस्ट ऑफ द टाइम्स जब पेरेंट्स को पता चलता है तो रेड फ्लैग्स के टाइम पे एटलीस्ट वी शुड विजिट द हॉस्पिटल, दैट इज एन इमरजेंसी,
Yes,
राइट।
yes,
बट शायद कुछ ऐसे भी कंडीशंस हो जहां पर पेरेंट्स इन माइल्ड सिम्टम्स को शायद घर पे ही मैनेज कर लें। सो कैन पेरेंट्स
yes,
effectively manage these symptoms or these mild clinical indicators at home? And if so, what
yes,
self-care measures would you recommend? And I'm asking this in context with steam also. I mean, does steam have a role to play in
yes,
relieving the
yes,
symptoms?
yes.
Okay.
Let's clarify or start with the steam. See, steam is something which is going to help only to your exposed area, right? So I always say maybe in sinusitis it will help. And definitely a child with less than 5 years old is not going to suffer much from sinusitis because it's less common. Sinuses are not that greatly developed under 5 years of age group, right? So,
Right.
steam will never reach to your alveoli, मतलब lungs के जो छोटे छोटे spongy areas होते हैं वहां तक steam ने नहीं जाना है, especially when somebody is having breathing difficulty, right?
Ji.
Because that times the airways have literally, this is the size of airway, it has gone down. The person
Right.
is even finding it difficult to exhale out, forget the inhalation, right?
Ji.
So
Ji.
steam तो out of focus है, करना ही नहीं है, उसका कोई
Ji.
मतलब नहीं है, okay? And
Ji.
regarding self-care measures, first of all, I feel that it's very important for the parent to understand, in case of pediatrics, whether the child has asthma, any other respiratory problem, any other chronic respiratory problems, right? There's another set which comes under, or if the child is recurrent wheezer, right?
Ji.
So in these categories, they should be absolutely knowing what their child has, right?
Right.
Second is, it's very important to accept if it's asthma,
Okay.
then in emergency, generally inhalers are given, right?
Ji.
So this inhalers has a big taboo in everybody's mind, which should not be
Right.
there. We have to really understand the inhalatory device, which is called as MDI inhalation, जो छोटा सा बॉलीवुड मूवीज में भी दिखाते हैं ऐसे ऐसे करके ले लिया. A
Ji. Ji.
proper
Ji.
technique of that with a proper device management, 100% ड्रग डिलीवरी कैन बी अचीव्ड. वेयर एज जब हम नेबुलाइजेशन देते हैं आपको दवाई पूरी तरह से मिलती नहीं है. दैट कुड
Okay.
बी इन फैक्ट if the child is not cooperating to take the device. Other than that, the inhaler is the most important device, right? And always in emergency the doctor prescribes कि आपको इसके 2 puffs देने हैं. If you
Ji.
can manage that, then you can absolutely avoid the emergency, right?
Ji.
And I
Ji.
always tell parents whose children are suffering from asthma, such devices should be carried out whenever you're going for some trips, some destination weddings, or some outings, so that suddenly if anything happens, the help will take a lot of time. So this is something which will
Right.
work in seconds or minutes, right?
Ji.
सेकेंड इज कंप्लायंस टू द थेरेपी. मतलब जो चीज हमने दवाई दी है, हाँ आप इसको ठीक है, आप इतना 1 महीना यूज कर लिया, इट इज फाइन, बेबी इज ओके, बेबी डज नॉट हैव एन इश्यू, बट इट इज समथिंग कॉल्ड एज अ मेंटेनेंस थेरेपी, ओके? सो
Okay.
अगर आप उसको सेट पर्टिकुलर टाइम के लिए यूज नहीं करोगे, सिम्टम्स विल एग्जैजरबेट, राइट? Third is finding out the triggers. Like some babies, they particularly have triggers in pre-winter times when there is smog in November, especially AQI rises. Some of them have in spring season when there is pollen, flowering time is there, right? So
Right.
during that time, at least you should not stop the treatment on your own. Discuss
Right.
it with doctor, right? Third point which parents can do on their own is to have what we call as primary prevention, to have a proper management in the room, child's room. For
Right.
example, dusting the particular surfaces, keep minimum things in the child's room, have sorters where you can, put the toys up again so that the child, I mean, the dust mites and everything, they do not form anything or any layers on the surface, right? So any inhalation ways where the child can catch up or form mites, where the child can catch up the infection is not possible, right?
Right.
Routine recommendation of air purifiers is not there. Okay, instead of that, if we can ventilate the room properly and close the windows during dust storms or something, and if we clean up the surfaces, it is good. Right. Third is about fungus. Wherever there are damp areas or watery areas, leakages, black fungus grows in house. That
Okay.
particular fungus should be treated because the fungal spores are very resistant to heat, and if the
Okay.
infection is caught up very early by the child, it is a slow infection, it takes time, and it is
Right.
very difficult to treat, right?
Right.
So that part they can do. Third is about vaccinations. They have to get their children vaccinated for pneumococcal vaccine and a yearly flu vaccine. That
Mm.
helps children for not having that acute episodes so
Right.
much. Okay. Mhm.
Okay. Right. So, like you just mentioned that the best thing about childhood asthma is that it usually, resolves. So, if it spontaneously
60 to
resolves,
70% at least likely
yeah,
to resolve. Yes.
okay, ma'am. So, can there be cases where it might persist as a chronic condition and it may
Yes.
progress into a child's adulthood? Okay. So, can you suggest us a to-do list of tasks for such parents so that they can manage their children, let's say, from their childhood days to the progressive years ahead, years coming ahead?
Yes. To-do task will be first, we have already covered those points that adherence
Right.
to the therapy and
Right.
compatibility to the therapy. You have to continue with it, not stop on its own. Third
Right.
and foremost important is a child is age is traversing from say 7 to 8 years of age to now 14 or 15, where the symptoms are still persisting. That is the time when the child also has to be educated. Child should be made
Right.
aware that this is a particular limitation, but it can be dealt with. It can be controlled, right? Then that gives very positive sense to the child's mind. Otherwise, there are many cases where children, as and when they become 16 or 17, they try to stop things on their own, and then they become in trouble. And when the trouble arises, they feel that something is wrong with them, right? Or they are less than others, and that should not
Right.
happen. If you
Right.
empower them with the right awareness campaigns and everything, they can do their checklist and they can compile those. Okay.
Okay.
Thirdly, I would say for parents is again in adolescent also these children should be vaccinated for flu.
Right.
Regular exercise should be encouraged in such children. Many times
Right.
we advise the inhaler to be taken before exercise, and exercise should be followed because see lung volumes and lung capacities has to be built up, right? And
Right.
they can definitely do yoga, pranayam. They can do breathing exercises. Only during the time of infection they have to do these things with caution. Otherwise, simple walk and everything, there is no problem. They can also do sport. Whenever the asthma is well controlled, age appropriate activity can be done. Right? There is no issue with that. So these things
Right.
should be discussed properly with child and parents both. And they can also have checklists like as they have to carry the MTS properly, the child can wear mask whenever required. And when they're going into public places like when there are crowded areas, so there they can do things with little bit of planning, beforehand, so that extreme crowds can be avoided. And seasons is another one. So during seasons they have to take care which things to be avoided, which things they can be done. Basic allergy checkup can be done. Sometimes we have seen post COVID there's something called as hyper IgE syndrome. So these internal allergies sometimes causes very acute episodes, recurrent episodes, which are distressing for the child. So if particular tests have been advised for such and such allergies, they can be done because once the allergy is controlled, the episodes and the medications are automatically, they get reduced in number. So that way, I think parents can deal with this particular asthma management.
Okay. That was very insightful, Dr. Meghna. Um, and we really appreciate your presence with us today, ma'am. And I'm hoping that this lightning information shared will be valuable to many families. So thank you so much for joining us today, ma'am.
Thank you. I would like to just give a signing off message is that
Ji.
certain things in life, can be controlled well. If at all it happens that 3 to 5% progress to permanent asthma, you should not feel extremely bad about it. It should be just well controlled, and one should know what really bothers them, and then you can plan accordingly to take care of it. And please vaccinate yourself whenever possible. And for mothers, it's very important to go for exclusive breastfeeding because that really helps children in the long run for certain conditions, including asthma. Okay, thank you.
Okay. Thank you, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, ma'am.